Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video, we're going to talk about how to treat a fever. Now, a fever is defined as any temperature over 37.5 degrees C. Now, a fever is the body's reaction to something foreign, and most commonly it's an infection. It tends to be a big problem in children, but luckily the management of it is quite easy. Fevers themselves, although they can be quite scary, are seldom harmful unless they're extremely high, and we're talking over 40 degrees C. And in fact, you don't have to treat a fever unless it's causing problems, causing any discomfort or distress, or unless it is really high, for instance over 40 degrees C. Now, it's important that fevers in small children and babies are taken seriously, and in those cases always make sure you seek medical advice. Now, treatment of a fever firstly involves some general measures. If you can treat the underlying condition that's causing the fever, obviously that's the thing to do. Secondly, other things you can do include staying in a cool room or making sure the room is not too hot. Avoid overdressing or too many layers in small children. Make sure you get plenty of rest and avoid any unnecessary activity. And sometimes having a wet flannel or tepid sponging can help, or even using a fan, but please be careful in small children because it can cause them to shiver, which is actually counterproductive. Now, the next step is moving on to medication. Now, first and foremost, something like paracetamol is very useful in fever. Paracetamol containing products might be called acetaminophen, Tylenol or Calpol. Also bear in mind there are lots of products in supermarkets that also contain paracetamol as well. Paracetamol is a very safe medication, but always make sure you check the dosage and make sure you're taking the right amount for the right person. And the other thing to bear in mind, because so many things contain paracetamol, try not to take more than one thing at a time and always check the label. Now, your second line of defense could be ibuprofen, for instance, Nurofen or Ibuprofen. Now, this is a different medication to paracetamol, but it's also very safe, but again, always check the dosage. It can be taken in addition to paracetamol if you need it because they're different medicines. Please always read the packaging and be especially careful if you have conditions like asthma or stomach ulcers because it may not be suitable for you. One thing to bear in mind is medication like aspirin shouldn't be used in children under the age of 16, but can be safely used in adults. So although fever is seldom serious, occasionally it can be a sign of serious underlying disease, and it's always worthwhile to get a medical opinion if you're worried, if you're not getting any better, or if it's a baby or a small child. Now, that's how you manage a fever.